This special edition of 13 News is brought to you by the Coronavirus Work Group, which includes the Barron River District Health Department, Bowling Green Area Chamber of Commerce, Bowling Green Independent School District, Graves Gilbert Clinic, Greenview Regional Hospital, MedCenter Health, Dr. Rebecca Shadowin, South Central Kentucky Community and Technical College, Southern Kentucky Rehabilitation Hospital, the City of Bowling Green, Warren County Emergency Management, Warren County Government, Warren County Public Schools, and Western Kentucky University.
President Trump declaring a national emergency.
Two very big words.
It's unpredictable, but if you look at historically how these things work, it'll likely be anywhere from a few weeks to up to 8 weeks.
Let me start by saying, Kentucky, we will get through this. It's going to be a major disruption that we face. Our lives are going to change and change a lot over the next couple months. And the steps that we have taken are significant, and we're going to have to take more as we move forward. But we are doing this to protect our people, and we will get through this.
Hello, everyone, and thanks for joining us. I'm Lauren Hansen.
And I'm Gene Burke. We're bringing you this special edition of 13 News live to bring you the latest information and numbers on the coronavirus.
Our goal for the next 30 minutes is to give you the best information that's available from our community leaders. We have medical and other community leaders standing by with a look at the proactive approaches they're taking to fight COVID-19. Now, here are the latest numbers from the Kentucky Department of Public Health. In Kentucky, 16 people have tested positive for the coronavirus, with 153 people tested and 139 negative results. Those numbers were updated just a few hours ago. Governor Andy Beshear held a daily briefing just a short time ago, and he says the state has 3 labs up and running to test for the coronavirus.
We have the state's web address and phone number that are scrolling at the bottom of your screen if you have any questions. Governor Beshear stresses if you're sick and would not normally go to the doctor, then call the hotline first for guidance.
The website is kycovid19.ky.gov, and the COVID-19 hotline is 1-800-722-5725.
It is us versus the coronavirus. And so we need you to do your part and to be a good teammate each and every day. That means following the guidance that's out there and making sure that you not only protect yourself from the coronavirus, but that you also make sure that you are practicing the type of social distancing where you would not be spreading it.
Nationally, President Trump and the Coronavirus Task Force, headed by Vice President Pence, updating the American people on their progress.
The House of Representatives taking action on a stimulus and when the Senate could vote. ABC's Rachel Scott is tracking that story.
In a rare Saturday afternoon briefing, President Trump, surrounded by top advisors, told reporters he has taken the COVID-19 test and is awaiting results.
Is your temperature normal, Mr. President?
This as reporters who were to be in close proximity to the president and vice president were temperature checked one by one. President Trump also urging people to avoid shaking hands.
Maybe people shouldn't be shaking hands for the long term because it does transmit flu and other things.
The White House expanding its European travel ban.
The president has made a decision to suspend all travel to the United Kingdom and Ireland effective midnight Monday night Eastern Standard Time.
American citizens will still be allowed to return to the United States, but will be funneled to 13 airports and subject to screenings and quarantine. The president's decision on the heels of a key House vote, overnight a bipartisan House majority passing the Families First Coronavirus Response Act.
The bill is passed, and without objection, the motion to reconsider is laid on the table,
which would provide paid sick and family leave, enhance unemployment insurance, and bolster food assistance programs like SNAP. The Senate expected to take up the bill Monday afternoon. Across the country, hospitals setting up tents preparing for patient overflow as officials scramble to increase availability of coronavirus testing. Long lines forming in Denver for drive-through screenings, and now a new concern for health officials, the increased demand for ventilators, the breathing machines that have proven essential in saving lives. It comes as all the major sports leagues have canceled or suspended play. Additional school districts make the decision to close. The Archdiocese of New York canceling masses starting this weekend, though churches will remain open for private prayer. The hope being these closures will help flatten the rates of infection. Rachel Scott, ABC News, Washington.
All right, this just in, and you're hearing it here first. Georgia has postponed their Democratic primary due to the coronavirus. This is the second state to do so. The first was Louisiana. Kentucky Congressman Brett Guthrie of Bowling Green produced a PSA to help prevent the spread of COVID-19. Let's take a look.
Coronavirus is rapidly spreading across our country, affecting our communities, families, and daily life. I'm Congressman Brett Guthrie, and I'm reaching out to make sure you and your family are taking everyday actions to help prevent the spread. Stay home when sick, avoid touching your face, disinfect frequently touched objects, and wash your hands often for at least 20 seconds. For more information or questions, please call 1-800-CDC-INFO or visit coronavirus.gov. With the proper precautions, we can all help fight the spread.
Dennis Cheney, the Executive Director of Ancillary Services at MedCenter Health, is here with more in the Coronavirus Work Group, which provides daily updates on COVID-19. Thanks so much for being here, Dennis.
Absolutely.
First of all, tell us about the workshop and where the organizations came from that are in it.
Sure. The work group is combined with strategic leaders from our service area, specifically city, county government, the school systems, the hospitals, public health, physician office practices, emergency management, Chamber of Commerce, et cetera.
Tell us about, you have a daily conference call that you do. What kind of things do you discuss?
Sure. During the conference call, it's an opportunity for the group to strategize. Each group reports out. We do a 24-hour look back since our last conference call, what has occurred, and then when we do a 24-hour looking forward, what might we anticipate. We do some problem solving and a whole lot of information sharing, and then towards the end of the call we decide what are going to be the key themes that we're going to put in social media posts each afternoon.
Okay. So far, thank goodness, there have been no reported COVID-19 cases here in our area. If there was to be a positive case, are we prepared for it?
Absolutely. We are monitoring in the entire medical community CDC guidelines. As revisions and updates come about, we're interjecting those into our planning. We're pushing that information out to the medical community. So consumers of healthcare can be so pleased and proud that we're keeping abreast of all the latest information.
What's it like to see all of these organizations come together to collaborate on this workshop?
You know, Gene, a couple of things that astound me about this. Whenever we decided on Monday that this was something that we needed to do to reach out to the community and convene a group of key leaders, when we started making those phone calls, each response was, yes, absolutely. What can I do? When can we meet? And so with just a little over 24 hours, we had our first in-person meeting with the leadership of each of those organizations present. And the commitment was do the right thing at the right time for the right reason. Be intentional, do everything we can to serve our community and protect our community.
What's it feel like to be a part of this organization, to get this kind of response in so short a time?
It's just amazing. I think it just speaks to the long history of collaboration in Bowling Green and Warren County and even our region. Again, just the commitment to always put people and the well-being of our fellow man first and lay everything else aside in the time of need.
Well, thank you for being here, Dennis, and thank the group for everything you guys are doing.
Just also want to just plug, we thank the media. Thank you so much for being our partner and educating our population that we serve, all of us, and just keep up the great work, and please feel free to reach out at any point in time.
All right, sounds good. Thank you.
Thank you.
Lauren?
All right, thanks so much, Gene. Amid coronavirus concerns, our local EMS has been prepared for a potential response at any given moment. Kelly Dean shows us how they would respond to a case like this.
Has he traveled in the last 14 days?
Armed with masks, gowns, and respirators. Jim Williams with MedCenter EMS says they're ready and have been.
We've been really well prepared for literally decades for the same thing, because in the end, infectious disease emergency is an infectious disease.
Their method of preparedness starts with dispatch.
Dispatch will interrogate a caller.
Has he had contact with anyone with flu or flu-like symptoms?
From there, the medics will determine what kind of gear to respond with.
We'll wear gowns to keep this stuff off of our clothing so that on the next run we're not spreading this stuff around to other people or other places.
A very effective option for medics the Power Air Purifying Respirator.
And this device has a blower or a motor in it that sucks in air and then cleans it using different types of cartridges.
All this said and shown, Williams says there's no need for the public to panic.
Hearing the gamut of people talking about this stuff, that it's the end of days or it's nothing at all to worry about. It's in the middle.
Reporting in Bowling Green, Kelly Dean, 13 News.
Earlier this week on AM Kentucky, Laura Rogers interviewed Dr. Rebecca Shadowin of MedCenter Health's Infectious Disease Department about the coronavirus, and here's what she had to say.
Dr. Rebecca Shadowin here with us this morning from the MedCenter Health Infectious Disease Department, and I bet you can guess what we are talking to Dr. Shadowin about. Yes, the coronavirus. So we're hearing a lot about this. We're talking a lot about this. Doctor, tell us, what is the coronavirus?
Well, it's a virus. We've had coronavirus in our medical illnesses for a long time. This is just a new species, which is not native to us. We believe jumped from bats in the Wuhan, China area to the human species, and now it's transmitting across our nation and our countries.
What are the symptoms of this?
The symptoms are that it's a respiratory illness predominantly. People may have flu-like illness to start with, and fever, achiness, cough, and shortness of breath. But it's a spectrum, you know, so you don't just present with all of that at one time necessarily, and there are people who are asymptomatic carriers of it.
And who is most at risk of this turning deadly? Because we are seeing a lot of deaths.
So the vast majority of this is not deadly. I think that's important to, you know, be comforted with. Those people who have underlying comorbidities, we call it in medicine. If you have diseases, diabetes, lung disease, heart disease, you're at greater risk. Over the age of 50, a little higher risk, but we're worried mostly about our elderly people. Children, luckily, tend to do pretty well with it.
It does seem to be spreading rapidly. Yes, originated there, Wuhan, China, and there for the longest time we had no cases in the United States, and it was like, oh, 1 or 2 on the West Coast, and now sure enough, here it is, and we have it, a handful of cases in Kentucky. Do we need to be concerned about the spread?
Sure. We need to be concerned. We don't need to panic. We don't need to run away because there's no place to run to. We've weathered many storms in our world of diseases, and this is another one that we will weather. So there's a period of time where we will have spread, and the big issue is understanding it and thinking through it. So you need to stay calm and be knowledgeable about it.
Because some people can be asymptomatic. Is there a way to contain the virus?
That's the big question everybody has, and nobody can answer that. It does appear we haven't been able to totally. We won't know until this wave of infection is over throughout our world how effective we were at containment.
The difference between screening and testing. That was a big discussion over the past few days. You all had screened a patient. They do not have coronavirus. We have no cases in Bowling Green, right, that we know of.
Not diagnosed.
No diagnosed cases in Bowling Green. Yes. What is the difference between screening someone for coronavirus and testing somebody for it?
It's very confusing to people, and that's the one thing we'd like to get fairly clear if we can. So screening means we ask you questions and do some preliminary testing. So have you traveled someplace, been exposed to someone who may have had coronavirus? And do you have any symptoms of fever, cough, shortness of breath? In the absence of those, we don't do anything to you. If you turn up positive on that screen, then we may flu test you, do some blood work, get a chest x-ray, and that's where the screening ends. So if you come up positive, meaning we don't have a good explanation for what you have, and you look like you could fit the case definition, you become what we call a person under investigation, or PUI. That's the screening process. And then we test for other things, and we partner with the health department typically to talk about whether we should proceed with coronavirus.
And then how is it treated? If you have a positive case, are there antivirals? What can you do about this?
There are some antivirals under investigation. Remdesivir is under investigation, and loperamide ritonavir is under investigation. They have a study at the NIAID that also can add drugs to it as we find more that are active. But the big issue that people are asking now about testing is, where can I just go get tested? And you can't do that. So we want people to know, don't go to your primary care doctor and say, I want to be tested for coronavirus. The person who's doing the testing on you has to be sure they don't get exposed. So you have to be in a controlled environment to be tested. So we don't test people unless they really have, you know, enough symptoms to make it worth testing.
And realistically, need to be concerned about getting coronavirus. How do you answer that?
Yeah, absolutely. And that's why I'm here with you. You know, as an expert in infectious diseases in our community, you're here trying to tell them the answers to the real questions. And that is that yes, be concerned and do what people are telling you to do what public health is telling you to do, be very clear on what we do. The media is trying to get that word out, and we hope you continue to do that well. So far, I've been very impressed with that.
All right, thank you. Nice to see you, Dr. Shadowin. We appreciate your expertise this morning. As we go to break, just another graphic here. We want to remind you how you can prevent the spread of illness. Washing your hands, avoiding people who are sick, covering your coughs and sneezes, staying home when you're sick, and cleaning those frequently touched surfaces.
Thank you, Laura. TJ Regional Health in Glasgow is taking precautions. Starting Monday, the pavilion will limit access to only patients. However, family and caretakers can accompany the patients. At this time, the hospital on North Ray Street has not made any restrictions. If needed, they will start to screen visitors.
We want to make sure we protect those individuals. We want to make sure we do everything in our power to screen, to educate, and to prevent spread of COVID-19 virus.
Dr. Wright says the way the country has been responding is because this is a public threat. The unknowns surrounding this virus also add to the heightened response.
Governor Andy Beshear recommended the temporary closure of senior centers to help halt the spread of the virus for those most vulnerable. As Allie Hennard reports, one local facility is taking those precautions with an aggressive approach.
You have to fill out a form, take your temperature.
Those are just a couple of the steps taken by Arcadia Senior Living Facility in Bowling Green amid the COVID-19 pandemic.
Arcadia Senior Living is taking a very aggressive approach to COVID-19. At this point in time, we have stopped all outside activities.
They're not allowed to leave or go back in without being checked, which is a good thing. So it's all protective.
No visitors are allowed inside unless it is a health emergency. Visitors may drop off items to residents, but must fill out a health questionnaire and get their temperature taken before doing so.
We can't even see them anymore. We could yesterday, but today it stopped. All we can do is take stuff in and get back out.
We kind of got out in front of this effort a little bit on yesterday and went ahead and started putting these practices into place.
This comes after Governor Beshear's announcement to stay away from nursing homes, senior living, and long-term care facilities.
I definitely respect everything that Governor Beshear said. I think he has the best interest of the state of Kentucky at heart, and we will follow all of his recommendations at this point in time.
Governor Beshear says the no visitor rules will be mandated at state facilities and highly recommended for private ones.
These are elderly people, and you know, they've got the sniffles here all the time, so you don't know who's got it or what. So
family members of the residents are pleased to see the health and safety of their loved ones taken seriously.
It's a precaution, so yeah, heck yeah. They're paying top dollar to be here, so they ought to be protected well.
Reporting in Bowling Green, Allie Hennard, 13 News.
And our reporter Allison Baker just got back from a cruise. As a precaution, our corporate office has decided anyone who goes on a cruise or leaves the country will work from home for 14 days.
And Allison is doing just that and joins us with a look at the precautions that were taken on her trip. Now, Allison, you had to go through a medical screening before getting on the ship. What all did that entail?
Yeah, Gene. So I've been on a few cruises before, and I've never really had to go through this process. So when I got to the cruise terminal, before we were even allowed to check in for the cruise, they made us fill out this questionnaire, and we had to answer if we had traveled through China, Hong Kong, Japan, Italy, Iran, Singapore, or South Korea in the last 20 days. And if you had, you weren't allowed to get on board. Also, if you had come in contact with anyone with COVID-19, you also weren't allowed, and you had to cancel your reservation for that cruise. Now, after you filled out this questionnaire, you headed up and you checked in for your cruise, but you weren't even allowed to get on the cruise ship until your temperature was taken. So they had people in lines, and they had these thermometers. They'd hold them up to your forehead. They'd read you your temperature, and if you didn't have a fever, you were clear to go and you could get on board.
And now you also said that they had hand sanitizer, they had hand washing stations around the boat as well. So tell us about those.
Yeah, so Carnival Cruise Line has always had these hand sanitizer stations and these hand washing things. Now, the hand washing stations are pretty cool. You stick your hands in these machines, and it has soap and water, and it washes your hands in 12 seconds. I mean, I think that's pretty cool. They've always been there, but this time it was a little different. So at every single food area that you could walk into, there was hand sanitizer or hand washing stations, and a staff member was kind of looking at you, making sure that you washed your hands before you entered into that location. And also on the first night, there's that formal dining, and they weren't even letting anyone into formal dining until you washed your hands.
Allison, as you took the trip, did anyone seem concerned about the coronavirus?
You know, at first, people were kind of joking around about the coronavirus, but then as we were on the cruise and news started coming in and NBA was being suspended and the NCAA tournament got canceled, people started getting concerned. And then there's a lot of college students on board, and they started getting emails from school. And my brother's actually a professor at Duke, and he got an email saying they had canceled their semester for in-person classes. And I think a lot of the other universities with some of the students that were on board did the same thing. And so they started freaking out. So I think there was definitely some concern later on in the trip.
And Allison will be in touch with you over the next 14 days as you're working from home, but we'll see you back here at the station in a couple of weeks. All 172 Kentucky school districts in the state are closing for at least 2 weeks at the governor's recommendation. Schools in the region are working to ensure that students will still be provided lunch with the schools being closed. Now, according to the Edmonson County Food Service Director, they've been working tirelessly to create a system to make sure that every Edmonson County student that needs a meal will be able to get one.
We're utilizing our bus drivers. They have offered to help us with this. They will pick up the meals at whatever designated school that's preparing the meals that day, and then they will go to these locations and they will be there from 11 until 12. And then people can come and pick up their meals.
They'll be providing these lunches from the 16th through the 19th, the 23rd through the 27th, and the 30th through April 3rd. They will not be offering meals during spring break. If your child is enrolled in Edmonson schools and you need a meal, please call their hotline at 270-597-8955. For food service information for other counties, you can go to our website to see the plans that they've sent to us.
United Way's Feed the Need takes place next weekend, and it's even more critical now with children out of school for several weeks due to the pandemic. United Way's vice president says many of the food pantries will be called upon during this time. The United Way is also still providing their Dial 211 resource, which has been in place for 4 years. During this critical time, trained specialists can provide up-to-date information on resources for people in our community. It will be available 24 hours a day, 7 days a week. With Governor Beshear's recommendation to be prepared to close schools within a 72-hour notice, some schools complied starting yesterday and others following suit on Monday. This leaves many parents scrambling to find childcare, and some parents rely on places like community education as a place for their kids to go when school is out in summer.
The schools are closed. We don't have a facility to operate in, to run our programs in. So at this point, we're kind of waiting to see what options we might have. We're trying to come up with some alternatives, some alternative ideas, some alternative plans. You know, we're trying to think outside the box right now.
And community education is looking into their options in offering their program during this unexpected break.
Over 100 WKU students are being sent home from overseas. The university has decided to pull students from Harlaxton College in England this coming after concerns of the coronavirus. Emily Bunning is with the program and says she's disappointed, but she understands. Students were told to get a flight out as soon as possible.
We're all just like devastated, but I mean, we understand, of course, why they're bringing us home, because for the safety of us and for other U.S. citizens, but it is unfortunate for sure.
WKU Semester at Sea is also being brought home. To follow Western updates, you can go to wku.edu/COVID-19. And our Allie Hennard is with WKU's president, Dr. Timothy Caboni, and they join us with a look on how the coronavirus concerns are affecting the university. Hey, Allie.
That's right, Lauren. I'm here with Dr. Timothy Caboni, president of WKU. Thank you so much for being here and
my pleasure.
Sharing with us exactly what you all are doing amid this pandemic. So first, can you tell me the decision to extend spring break and why that decision was made?
So all the decisions we're making are really focused on two things: taking care of our students and taking care of our WKU community. And what we knew is that we would have 5,000 students who live in our residence hall coming back from all over the country and from around the world. And we wanted to make sure we kept them as safe as possible. And so creating some distance between them, extending spring break, giving some additional time for our faculty to retool their courses so they'll be able to teach online, starting on the week after spring break, the 23rd, was important to us. We want to make sure that we're open for business, but that students who have the ability to go home do that.
And we just discussed this semester at sea students and those that are quickly returning home. How is that going so far?
Well, you know, we have students all around the world. We have about 150 left to repatriate. Our international office has been working tremendously hard, really for almost 7 weeks since this started in China. We began getting students back from China then, and it's continued. And so we still have some work to do. I just learned that our last student has returned from Italy, which is a good thing. We have a couple more in Spain. We have 15 students at WKU in England, at Harlexton, that we're trying to get back, and so we're working hard every day to get those folks home.
And the Conference USA basketball tournament canceled, among other tournaments across the country canceled. What have you heard in terms of feedback from fans, players, family members?
You know, this is an interesting time. The things that we're doing today, if you had said just 2 weeks ago that we'd be doing them, I would have laughed at you. And so I think folks understand that these decisions are not being made lightly, and they're made for one reason, for everyone's health and safety. And so I feel for our student athletes. I know they're disappointed that they didn't get to finish out their careers the way they wanted. But at the end of the day, this is a time for each of us to sacrifice individually so that we can all get through this together.
And we were discussing earlier about the residence halls remaining open. Why did you all decide to do that, and why is that so important for students who may not have another choice?
So we're going to continue with our schedule. Residence halls will open tomorrow, March 15th at noon, for students who need access to them. I know there is a conception of what a student does on spring break, but the reality is we have several halls that remain open over the break because students need to be able to work, to get food, to generate income to be able to pay for this experience. A third of our students are low-income students, and so I want to make sure that those young people who are working hard and either don't have a place to go or need the food that's provided or able to work their jobs have a place to be. Now, it's not going to be like a normal day. There won't be visitation. We're going to try to keep folks from going up and down to different floors, but we want to make sure it's available for them. For young people that can go home, it's a good choice right now.
Well, thank you so much for keeping the students, the university, the campus safe, and thank you so much for being here to share your thoughts with us.
My pleasure.
We'll toss it back to you in the studio, reporting live with Dr. Timothy Caboni, Allie Henner, 13 News.
Thank you, Allie. Effective this Monday through April 10th, all SkyPack and Capital Arts Center events will be canceled due to the coronavirus pandemic. Warren County Judge Executive Mike Buchanan made that announcement during a fiscal court meeting yesterday. The events at both venues include Waitress the Musical, the Beatles Tribute, and Rain. The coronavirus is having a negative impact on what is normally an extremely happy day. According to one local wedding venue manager, the wedding industry is taking a hit due to the virus, raising concerns for brides about if their dresses will come in on time, if attendance for their wedding will be low, and in some instances, if they should consider postponing their wedding. Robin Ford, venue manager at the Charleston, tells 13 News one of her brides had to do just that.
One of our bride and grooms let me know that the coronavirus, because the coronavirus, that her family from China would not be able to be coming over to attend her wedding. So, you know, I immediately felt very sorry for this bride because every little girl wants her mother to be at her wedding. And so at that time, I actually offered to postpone the wedding, choose another day.
The family was working to set a new date for the wedding as they wait to see when a good date will be.
There's a wealth of information on our website and WBKO's app concerning the coronavirus and the nation's, the state's, and the local communities' responses.
You can also call the state's hotline number or go to the website at the bottom of your screen for more information on COVID-19. Thank you for joining us. We'll see you back here for 13 News at 10.
This special edition of 13 News was brought to you by the Coronavirus Work Group.